Hi everybody, it's Melissa at CIM. We're going to go get started in a second. I just want to make sure that the recording is going. Okay. All right, so the first part we're breaking up this webinar in two parts. The first part, we're going to cover the Connect to Care New World, and the second part, which is a much smaller piece, is what else is included in our release for 319 that's not related to the Connect to Care piece. So if you want to sign off at the end of the Connect to Care piece, then you can feel free to do so. That's why we split it up in this manner, because we knew that some people aren't going to be paying attention, need to know about the 319 changes because their jobs don't relate to that. So anyway, to get started, I opened up the user guide. You should be seeing that on your screen right now. On page 86 of the case file user guide starts the Connect to Care information, and so this is where we documented everything we could think of to tell you about the new part of the system. And so that's in the case file user guide that you can find under the help menu in Compass, under Compass user guide, case file user guide. First thing we want to start with is we're going to be using a lot of acronyms as part of this, so we wanted to define those for you. So the first word, or the acronym we have, is the ACRES, we call it. So ACRES is ACRS, and that stands for Active Client Relationship Service. And all that really is a file that we create to send to MyHIN, which I'll explain who that is in a second too, the people that you have a healthcare relationship with. So these are the people that you have open episodes for and are enrolled in the programs that you have specified to me before, or if you didn't specify it, everybody in your agency, so that you can start receiving information from other healthcare organizations for those participants. So all that is, that ACRES file is a file that we'll be sending monthly to MyHIN to let them know who you are working with, so that then they can send us the information. Okay. The next one is ADT. That's an admission discharge transfer file. That is a file we receive from MyHIN to process the admission, discharges, and transfers from the hospitals, nursing homes, and home health agencies. We do want to let you know we don't process transfer requests per se, because it didn't have information that wasn't already being provided in another, like a discharge notice. We get that. We get the admission. So we didn't process that because most of that is all related to moving within the hospital to a different level or a different room, et cetera, so within that facility. So it just would clutter up your information of what you're receiving. So, but we do get a separate discharge notice if they're discharged from that facility. So that ADT is just a file we receive and process to send of the admission, discharges, and transfers. Well, not transfers, but then the next one is CCD. That's the Consolidated Clinical Document. So that's another file that we receive, that this is going to have a lot of information about the person's medications, diagnoses. It could have their history, their physicals, progress notes, care plans, discharge instructions. There's a whole variety of things you could see depending on what they sent. It's never the same. Each organization may send different things for different people based on different situations. So that will vary greatly in the information that you'll get to see, and we have no control over what you get. We just show you what we get. So we send an ACRES file, and once we send that ACRES file, then we start receiving ADTs and CCDs. That's basically what Connect to Care is all about. So MyHIN, that stands for the Michigan Health Information Network, and I posted from their website what they are: a public and private nonprofit created for the purpose of coordinating and building bridges between the healthcare providers throughout the state. So they're the ones that receive the ACRES files and ADTs and CCD files from everybody throughout the state and send them out to the participating healthcare organizations. Then the other acronym we'll be using is NPO. And NPO is Northern Physicians Organization. So they originally started working with Region 10 Area Agency on Aging, and have many other customers as well for several years, sending ACRES files and obtaining and cleaning those files, and because there's a lot of information that is very overwhelming. So they have taken it upon, worked with other customers to try to figure out, okay, what do you actually need? And so they are doing that service for us, and so they are kind of the middleman, for lack of a better term, to be able to weed out that non-essential information and duplicate information that may be coming from other organizations. So they're the ones that are actually sending us the files. So we send our ACRES files to NPO. NPO cleans and sends with the rest of theirs to MyHIN. MyHIN then sends back to NPO, who sends to us. And all of this is in real time. It's all electronic. None of this, the information, as soon as they post it in the other healthcare information system and that they send it into MyHIN, it comes right through the wire. So all this stuff will be coming through very quickly in real time. Okay, so the next piece is talk more a little bit about the ACRES file in here, and it is, like I mentioned earlier, sent monthly. We are right now going to be sending around the 15th of the month to NPO, and that will contain person identifiable information so that we can then know that that person belongs to you. So we send that information for people that you have an open episode with on, let's say, the 15th of the month exactly. It's right around then. So whoever you have open in the programs that your agency specified. So if you want to change that, you can send an email to the help desk and we can change which programs are included. For instance, you may start receiving information and go away. Yeah, so these programs, yeah, we don't want this. It's too much. We then can take them out, and then when we send the next monthly file, then you'll start seeing them not show up anymore. So it is going to be about a month of lag time of changing that to the programs. But most people are going to want waiver, which most of you have, or your other programs you may include as well. So the monthly file is a full refresh of the previous month's file, so that if people drop off and close in your agency, then they won't be in next month's file, or if they change programs, they won't be in next month's file. So, but like I said, there could be a lag of people coming in. So listed below is the information that we're sending. So there's a system-generated GUID we have on our system we're sending to them so that we can link the information that they send back, the person's name, date of birth, gender, the last four of their SSN, their address information, and their mobile phone if they have one, otherwise, just their home number, which could be the same as the mobile number. So we also send them, of course, we have to send them your agency information, including an organization ID that was set up in MyHIN to identify you as an agency on their side. So that all will be included in that file. So that's really all the ACRES file has in it, is this information about the person with your agency information, so we know that your agency needs to receive it, and we send that monthly. All right. So the most important part of the system to set this up is that you need to have the permissions assigned. So there are two new permissions in Manage Users, which I'm going to go flip the switch and go into that. So if we go to Navigator, this is the test system, but it does have de-identified things but not users. So if we look at, for instance, our WISP account, in here you're going to see a new case ADT CCD. This allows you a view permission to see the ADTs and CCD data within the case file. So where your assessments reside, where your progress notes reside, if you want to be able to access that, that's in the case. So sports coordinators are going to want that, and anybody else that is going to be managing the ADTs and CCDs will need to have that. So that's the base one. You cannot even see CCDs information without having that permission. So that's pretty much the base permission you want to access to see the detail. Then down below at the bottom is the Compass Next ADT CCD notifications. That has a view and add change permission, and this allows you to see the notices that come in. So some users may not have this and others may. Then they may want the case one without this etc., because they may want to see it in the case file, but they don't want to see the notices themselves. That's fine. But they can view these, and then the add change one is about, there's two functions in here that we're going to talk about later of archiving them and assigning them as an ER visit, and that functionality is controlled by that add change checkbox. In order to have this Compass Next ADT, you also have to have the regular Compass Next permission. So if right now you do not have Compass Next, like when you log in you don't see this left panel, then you will need to have that assigned to you as well as this in order to get access to the ADT CCD notices. Okay. So those two new permissions. So right now, no one is assigned them. Whoever sets up your user accounts would need to go in and assign them to each user, unless they've done it this morning. Of course, since the release came out, they may have done that already, but otherwise they are not assigned. So when you log in, you won't see it. So somebody has to go and assign these privileges to you. Once those are assigned, then if you're already logged into Compass, you have to log out and back in order to refresh the permissions and see that information. Okay. So, and that's all listed in here too if you've put more questions about what those do. All right, so now we're getting kind of to the guts and glory of the ADT and CCD notices. So I'm actually going to flip back over here and show you the system. So there's this new ADT CCD notices, and you see that there's a number here that tells you how many notices you have currently that are not archived. So as things come in, that will start growing. Right now in production, we haven't gotten any new notices since we went live. So no one's going to have any number there. Even once you get the permission, this will be blank. But right now, when you click that, you will get a new screen, and at the top is going to be current notices versus archived. So it has a feel like a vendor view, but it's not vendor view. You're not going to vendor view for this information. It just, that's the similarity and where it ends, really. You can search for people. You can filter by the primary sports coordinator in here. Otherwise, it's going to show you in order by the receive date time, all the different notices that your agency has received, unless you filtered it by these two things. You can sort these by changing the sort by clicking on the sort. So maybe you want to see those. Maybe you want to sort by name, so you can see all of those. You can also sort secondary and tertiary, or to whatever number of columns. I couldn't even tell you what those words all are, but by doing the shift button, holding the shift key down, and then clicking, and see, then you see that then it's 2 and 3, etc. So that's how, if using the shift and click can get you multiple different sorts in here. So there's that. Then there's the receive date time. That's one that came in. Who sent it? So the organization that sent it out to, well, to you, but they don't know they're sending to you. They're sending to anybody that cares about the information. The person's name and the notification type. These primarily are what you see is what you're going to see with a few, I mean, as far as we know yet. You'll notice that some of them are linked. So the blue ones are you can click on, and the gray you cannot click on, and I'll show you that in a second. But the ADT information is the ones that you can click on. CCDs will look like this at all times. So CCDs you cannot access from here. You can only access the CCD information from within the case file. The patient class, this can vary. Some of them are programmed to give you the words. Other ones were newer since we found out, since we started testing, like this OB one. So it's not programmed to tell us what OB stands for, but if we click on the discharge here, it then says observation. Okay, so in the ADT, it tells you the person's name. Message sent, so far it's all been blank. We don't know if it will ever come in, but we didn't know, so we added it. The receive date time, who sent it, this identifier. ER visit right now is false because we haven't done anything with that. I'll show you that in a minute. The patient class and the hospital service type, those are just some codings that then are described here in this field. The admit time, so this is the time that they were admitted, so at 1:30 in the morning on the 18th, and then they were discharged at 1:19 p.m. on the 19th. And it'll tell you their discharge disposition, so home or self-care. Diagnosis code, if they include it, is here. Otherwise, they may just give a description. This may be empty. We show you what we get. So we may not get all of these things. We may get all of these things. It just will vary. So, and as we get more experience with the data coming in, we may be tweaking this information as well. From here, you can see reviewer and review date. That is your information. So when you archive a record, and if you pulled this up, that will be your user ID and date showing. This is where one of the ways you can mark it as an ER visit. This is used for reporting in the, I'll show you later. It is not built into the care setting information. None of this is. And so, but you can mark this for future reporting that you may want to do to find out, you know, how many ER visits, et cetera. You could track it that way. We do want to caution you on this, and I'll show you here why. So these four, or these three events here, admits, were on the 16th. And we have one emergency type, one admit, and one discharge. Technically, if we scroll to the right, we could mark them all as ER visits. If you mark them as three ER visits, then when you count them up, there will be three ER visits. So you need to be careful that you only mark one of the events as an ER visit so that you don't count them multiple times. And this could be tricky for whoever's going to be doing monitoring and marking these, because you may have already archived ones that they were the initial admit, and now the discharge comes in 2 days later or whatnot, and don't mark that discharge without checking if the admit was already marked as an ER visit, for instance, okay? Because you will have, this is, you know, for demonstration purposes, we kept them all here, but normally you wouldn't receive these all at the same time. You'd already have archived some of them. So, but you could, I mean, we would let you mark these all as ER visits. This is another way you can do it. And you just click it again to take it back off. And you can also, from the archive notices page, mark them as ER visits there too. So you could take them off. I click over here. The ER visit, we just go to the right, is also in here. So you can check and uncheck them. But you notice that ER visits are not available for CCDs, because CCDs are not part of a hospitalization necessarily. Could be, but may not be. So that's ER visits. Archiving, you can archive like one by one. Like when I clicked on this and saw the information, I could archive that right then. Otherwise, I could check this box over here and click the archive down here. I could check this top box. It checks them all. If you want to clear the whole screen and archive, you can do them all at one time. I'm not going to, because I want to keep the data here. So that's all available to you as well as an option. And let's see, what else do I want to tell you while I'm right here? Okay, so let me just catch up. Oh, the other thing I want to show you too is there's this bottom bar down here that also has the number of the 51 that are not archived. And that bottom bar is also there because you may not know the count. And if you change the settings on this to small, you will no longer see the number on the left panel, because this makes more room for you. So this allows you to see that still without having to click. Let me change that back to automatic. Okay, so these are literally going to be the same number, but you do have a bottom bar that will show you as well. Okay, checking on my notes to make sure I don't skip anything as I go. All right, so let's say you get admit, let's say for Beth here, and usually on 8/16 they go into the hospital. What you're going to want to do is check to see, have I already gotten that information, you know, from another source, via a vendor or whatnot. And then you may want to click on them and see the participant summary of the care setting. The care setting last was at home. So because it was home on 8/2, that means that no, you have not changed the care setting to hospital yet. So at this point, you would want to go to their status record and update their status to add that hospitalization as of the 16th. So I don't know if many of you have seen the participant summary before. It's on the to-dos in the dashboard, etc. But if you click on the person's name in here, this summary will show up. And all of these navigation items are available up here. You can go to statewide search. You can go to the participant record. You can go to the case file. This heart button is your status, the assessments, the progress notes. You can add a progress note and get to the attached files all from this one window. It's very convenient, as well as you could add them to sync, your next sync in Compass Go straight from this thing. So at this point, you could go open up her status from here and go update it if, you know, there wasn't a bug that we just found last night. So it will work once we get a hot fix release out. You can get in there, but once you get in there and click around, you're going to get an unexpected error. So right now, don't use this button. But you can go the regular way that you normally go through. Go to Navigator, open the person's case, go to find the person, click status, and get into the record the normal way. So right now, just want to warn you that while this is the quick and easy way from this, it won't function until we get a hot fix release out, because there's something going on that it's redirecting you wrong. So you can do that. You could also go into the case file, but, you know, alternatively, you could go here, or you could click on assessments, for instance, and then use the quick links to go to status, and that would work. Or go to the progress notes and use the quick links and go to status. So you don't have to go the Navigator route. You could use these other guys, but status right now, don't use that because it will not work right. But this is the quick and easy way you can tell if you've updated the care setting record yet based on that information, okay? Especially when the discharge comes through. And right now, especially, you might have people in the hospital right now that you'll never have gotten an admission on. You'll get a discharge. And so then you could check, oh, yeah, so did we even have this to begin with? Nobody told us that they went in the hospital. So then you'll know and can add it on a discharge. So don't just think that just because it's a discharge, it's already in there. It may not be in there yet. So, but the discharge will have the admit date on it as well, usually. I mean, so far from what we've seen. We'll see what happens in the future when we get more data. Okay. The other thing I wanted to make sure you know, once you archive notices, you cannot undo the archive. So make sure that when you archive that you're the person that's supposed to be archiving, so you don't screw anybody else up, and because it cannot be undone. You can still get to the information from the archive notices page and get to the access, all of it, so it's not like you really lose anything. It just will come off the current notices page. Okay. The other thing too is because of the timing of the monthly file, so we send the monthly file of all your open people in these enrolled in those programs that you specified, and then let's say 2 days later they close, okay? And you don't care anymore about their hospitalizations because you're no longer involved in their case. I mean, maybe sometimes you are, but most likely you would not. Once they're closed, this is closed. So if you close the episode, and then if we do receive an ADT or CCD for that person, we are going to auto-archive them. So they will not show up on the current notices page. We didn't want to inform you about things for people that are closed, and it's just a timing issue of when we send the next file that excludes them, okay? So you could get to them in the archive if you wanted to, or you could get to them through the case file and see them show up after they were closed. It's just the timing issue, and we're automatically doing that.
There's examples where it shows what it looks like.
Oh, okay. Emily set up all my examples, and she's telling me that there's examples. So when that happens, we're going to have the reviewer will be Compass MI in here. So you'll see right away that that was not archived by your agency. That was archived by the system because those people were closed when the record came in. Okay. Now, that if you change them though to a different program that's not in your enrolled program list. Okay. So let's say LCM1 is a program you guys use, but you chose not to include them in the ADT piece. So if LCM1 is not included and you change somebody from waiver to LCM1, so waiver was, and they were in the list, when those notices come through, they will not be auto-archived because they're not closed. So we're only doing to the closed people. So those people, you would continue to receive ADT and CCD notices until the next month's file, where then if they're still on LCM1 and LCM's not an included program, they'll drop off the list. So you will possibly see things for people that were no longer part of your program list, but they didn't close, so we don't auto-archive them. Okay. The other thing about archive notices is that you can change the date filter. So if you want to see different time frames, we default to show you only a full month, but you can change that to whatever you want, except for it cannot exceed a year. So if you want, you can, I mean, once we have a year's worth, right now it doesn't matter, but when it does, that will be unavailable to do more than a year. You could search for a year ago, but only within a date range for that period, within a year. Okay, so the next thing I want to show you is, if we, let me go back here, I want to pull my person. Okay. So I'm going to go to, so the other thing is, I want to go to the case file and view this CCD. So we do not have a shortcut to take you straight to ADTs and CCDs. But my cheat is that I'll go either to the assessment or the progress notes, and then I'm at least in the episode that I can click on ADT or CCD really quick. So I'm going to click on assessment for her, and then I'm going to quickly go click on ADT. So these are in the case file where the ADTs will reside, and the summary will show you all of the ADTs within the last 6 months, okay? After 6 months, they will drop off. They are still going to be available in the system, just not shown here. They'll show on the new report that is up available in the list called ADT, and I'll just pull that up right now and show it to you. So the ADT report is going to tell you the notice type, the admit date time, the receive date time. There is no discharge on this one. There is one down here. So who sent it, whether or not you classified it as an ER visit, the patient class. So basically that same information we were seeing. Okay, so this was an admit, this was a registration, this was a discharge, a couple discharges. You know, some have the diagnosis of this one has hypertensive crisis, but these guys don't. Okay, so it will show all of the ADTs, not just limited to the 6 months on the report, but it will only show 6 months on the screen here. Individually, you can click on this little pop-out button, and it will pop up that same information that we were seeing within the notices page, just in here. You can print this if you want to print it. You can close it by clicking the X or the close button otherwise to get rid of it. So that's how you can get to access to the ADTs from within the case file. And then, like I mentioned before, the CCDs, they're only available in the case file, the detail, because that had no link on that notices page. So you'd come in here, you'd again see the last 6 months of CCDs. We don't show them all either. These were more difficult to set up for testing purposes, so we have one person that I can show you an example of a CCD that was a mock-up that somebody gave us. So this is an example of, it's a totally not, this is not true. You'll see they're from Florida and spots. It looks real, but it's not. So at the top, there's a table of contents that you can click around to expand, or, you know, these little icons you can click on to close things down, or click them to open them back up. Okay, so this is going to have a lot of information, and this is where we have no idea what you're going to see. I mean, we have a general idea because of what's come in, but it could vary greatly. This one here that I'm showing you is actually not as typical of what we've been seeing. It's somewhat there, but not really. So you may see a problem section, you may not. You may see a plan of care section, you may not. Like this is an example of all the medications that they had. So it goes on and on and on and on and on and on and on. It's a lot. And they give start and stop information. And, you know, we want you to, you know, use this carefully, because this may not be 100% true. It's what they think it was. It's coming out of their system. But you may not want to just take this as this is solid information and go and update your case records to reflect this. You're going to want to verify anything on here with the participant to see that these things are truly in effect. And like I said, we don't have a clue of, you know, the validity of the information coming in, just that you're going to be getting it. So then this medications is one example, and then there's also another one for medications at time of discharge you might receive. So these are what, you know, they gave them at discharge supposedly, or that they knew about at the time of discharge. So that's more information for you to follow up with. This, because of the nature of any of this data, none of this information will update your case file or care setting statuses. We don't know, you know, what effect this will have, so it's all human interaction to review the information and determine what actions you need to take from it. You could use this as, you know, a tool to, you know, check what you've got in your records and to validate with the participant, but it may not be correct. We don't know. And there's other sections like vital signs, lab results you may get. So you may get, yeah, this is a whole bunch of labs that were done, thyroid panels, and you can get x-ray information and urine analysis and social history. There's just a lot of information here. It could be very overwhelming. But if we receive them, you will get a notice about them. I think I can say that we get less CCD notices than we do the ADT notices that we know of. I mean, we've only been able to test with 2 agencies due to a time lag with the ACRES file. We had issues with our middleman and MyHand themselves in delaying, and we haven't received any information on anybody but 10 and 2 so far. So once we start receiving that, we can maybe narrow some things down, but at the moment we're giving you everything we've got that we're getting so that you can decide what to do with it. But so advanced directives was a section, and at the end you'll see a bunch of information about the person and consents and who knows what they'll send. So like I said, CCDs could vary very greatly, but they are available here. Now, the one thing we want to warn you about is the CCDs are not available offline. So if you do want to take that information in the home to verify with the participant, you're going to want to either print that out, print it to a PDF document, to store it on your laptop, so that you can have that readily available. The other piece of that too is that we are going to only show you the last 6 months of CCDs. So if you find a CCD that's very valuable and you want to keep it attached to the case forever, then you're going to, again, want to PDF it and probably use the attached files piece and attach it to the record so that you have that permanently and it doesn't disappear in 6 months. So that's up to you. But for now, we are only showing it the last 6 months. Now, we are keeping them all, so I guess worst comes to worst and you really know that you want to get something, we could get access to it. It would be painful, but we could do that too. So it's not gone, it's just not visible in the app. So far, we have no plans to archive any of this data, to delete it or move it somewhere else. So it's just what you see. The other thing too is, you know, throughout these things, you could go in here and copy paste. I mean, they're just web pages. You can Control-C, right-click and copy and paste it into the case file, a bunch of stuff if you want to, through the ADTs and the CCDs. That's, you know, an option as well. Okay, catching up on my notes. All right, so then another thing we did as related to the Connect to Care release was part of the Connect to Care piece was to help better track hospitalization. So another thing that we've done is we have changed in the status the hospital records. So in here, all of your existing hospital records now say hospital unplanned because we don't know, and so we just assume they were unplanned for the past history. But in the future, there are now going to be the planned and observation only options, okay? So that you can do better tracking in the future for tracking hospitalizations to know that information. We also made a change that throughout the system in many scripts and reports we classify certain things as home. So we have added a prefix of home on things that we consider that is a home value. So like the bills when not at home script, these things are considered home for that script. So we will not show you if they're in a home for an aged because that is their home. But it is a classification of the home. So we wanted to make you aware of that change, and then your hospitalizations you can track differently now too. If you choose to, you could continue to use just the unplanned, et cetera, but that's available. We also made some script changes related to that are at the end. I'm not going to go through those. They explain though at the end of what those script changes were and what changes we made to those. And then the other thing I want to show you is that there's also, related to this, a report in the reports portal for the, under the participant. There's a ADT detail report on, in here that you can run for a person by date, or not, for a person, you could choose that. You could also choose the date range. You could choose programs that you want to identify to. You can run it for all ADTs or just ER visits only. You could do the current initials of your SCs. And there's actually two reports that can generate from this. One is the regular one, and then if you want to page break by supports coordinator, which is the breakout, you can choose yes, and that will print. And I ran some already, so we didn't have to sit here and wait for it to run on our local. But this is what it'll look like. So Beth Baldwin, what program she's in, that the ADT type information is here that was received, as well as the care setting status. So any care setting records that are within the date range that you run it for will print so that you can compare and see that, you know, you entered or did not. Like in this case, I did not enter a hospitalization. So that's an indicator to me that, oops, I need to go put one in. So it will run all of the ADTs for that date range. And then there's the breakout by supports coordinator. That is basically, it just breaks it down by the different supports coordinators involved. Okay. So that's what those are about. And then, let's see. Okay, so that pretty much wraps out the ADT CCD Connect to Care piece. There's a couple notes I want to mention about what to do from this point out. So from this point, we have not received any notices yet. You will want to go in and assign the permissions to the users that should have access to this. You're probably you'll have to just make a decision in your agency of who's going to be responsible for archiving and marking as ER visits. It may be a central person or persons. It may be that each supports coordinator's role will be to do that. That's up to you guys. But I think from what we've heard, most people were thinking about doing a central person or people if they, back up, et cetera. And then we do also want to, caution you, because this information, we've only been able to do the two agencies worth of information to compare and, know what to load. So we could run into some issues on our end, or we'll make tweaks to add more information if we start getting more information that we weren't with the others in regards to the ADT. CCD is kind of what you see is what you get, but the ADTs, we might get some different information we don't know yet. So we'll be monitoring all of that on our end. We did have some issues initially that we mentioned on the MSB call of duplicates coming in, and we've resolved some of it. Some of it we found a problem on our end that's been resolved, and then there's also there are true situations where their system is sending us duplicates, and because it's not probably a duplicate to the hospital, they make some change and it issues another one, and so we're applying an algorithm to remove those from the system when those happen, so that you don't see the same thing over and over again. There's also an issue that I'm not sure where we're at yet, with MyHIN was providing duplicate CCDs, that should soon be resolved as well. I think we saw some movement on it already today. So you may see some duplicate CCDs if they come in, when they come in, since we haven't gotten any yet. But, so if you are seeing things like that, please feel free to contact us, because we may not catch everything, and we can look into it and see if there's any issues, or if that's, you know, really what we got, because this is all relatively new to us as well. So I see I have some questions. If you have questions, go ahead and type them in. I have some. If you don't use Compass Next, how are you going to receive notices? We will have to figure that out. And 1B is asking, they're set up a little bit differently. So I think we figured that out, but let's verify that quick. As well as care settings affecting the clearinghouse file format, it's the same. You could use the 2 new ones if you want to, but the database values are still the same. 16 is for planned and 17 is observation only, for those that do queries. And otherwise, the regular unplanned is the same value of 2 that it was before. And yes, you will, everybody involved in the Connect to Care project will have access to the ADT report and the detail one in the reports portal. If someone goes to out-of-home respite at the AFC from home, what would the status be? That I'm not 100% sure on. I think agencies are tracking that differently. I know there's a question I'm going to be discussing at the waiver director meeting about out-of-home respite and how that factors into nursing home stays for the 7-day rule. So we'll be talking about that at the waiver director meeting. So I can't really answer that question yet. That's all I've got so far. I'll wait a couple minutes to see if there's any more that pop up. Are all hospitals in the state of Michigan participating in this program? There are a lot of them are. I don't know the latest. I sent out to the waiver directors a list a while ago of who was participating. There may be a few more that have been added, probably not too many more, but it is most of them. So I don't know who not. It's very small. I mean, I think even the small hospitals aren't. I think it's more of small practices and outlying type of organizations that are not. And then there's a note too, I guess, if we can't figure out the 1B issue with Compass Next, we technically could set up the email system like Region 2 and 10 had before, but I think we'll be able to figure something out so that 1B can use it. So we won't need to do that. I think we figured it out, and I just can't remember off the top of my head. The edit permission, what allows the archiving of notices? So in the permissions, there's the Compass Next, ADT, CCD notices. That add change permission is what allows you to archive notices and mark as ER visits. Those 2 functions are on the add change only. Okay. So you could give people the view privileges and they could see the notices and not be able to mark those if you don't give them the add change. So that's an option. Okay. All right. I'm going to go ahead and move on to the 319 part of the release since I don't have any other questions sitting here, and show you a few more things. Those of you that don't want to participate in that part can sign off if you want. One thing I wanted to show that we know is underutilized, and it's kind of related to the participant summary I just showed you, and that's this participants piece. So the participant search is not new. It's been in Compass Next for a while. Some agencies are using it for like their intake staff, because this will search all of the participants in your agency at any point that they were ever served, versus anywhere else in Compass. When you search for participant, you have to have different pieces of data. For instance, you have the wait list selector that only ever show you people that were on a waiting list at some point. You have the Nifty portal selector that will only show people that were in Nifty at some point. The case file selector that will only show you people that had an episode at some point, versus participants will show you everybody. So it's a very easy way to find people and to find out the latest and greatest information on them. And it's got a few different features in here. So, for instance, I can search for Mel Owen, and it's going to find Melissa Owen, okay? So I didn't even have to put the full name in, and it's not formatted in any way. So I can pull up Melissa Owen that way. I could search by the phone number. And it does have to include the area code, not just the 7 digits. You have to have the area code too, and it will find that phone number. Some people were using that because the caller ID came in as an unknown number. They want to know who called them and to call them back, or for screening purposes, which is bad. But so that you may want to type in the phone number to figure out who was calling you, because you're most likely it was maybe a participant. And you could search for by Medicaid ID, the last 4 SSN. Basically, I think everything in here, but maybe not county, I can't remember specifically. So it's a very good tool that you can use to search however you want and filter down more. Some of the larger agencies may want to use this because they've got so many people with the last name of Johnson that they're going through 10 pages just to find, Roger Johnson, for instance. So you could put Roger Johnson and pull him right up in a snap versus scrolling through, because you can't put a first name search in the case file selector. So it's just got a lot of neat features. And then when you click on somebody in here, it will then bring up their information, which I haven't done anything for a minute, so it's slow. So it brings up my information here, my to-do list of what is coming up, my all my most recent information, my preferred method of communication. If there was critical info, that will show up here with a red flag, so you'll know that right away. And then your most recent information on your statuses and your primary sports coordinators, et cetera. And of course, like I mentioned earlier, all this navigation. So it's a really quick and easy way to find somebody and get them in the system that I just wanted to reiterate that exists, since I know that many haven't used it. The other thing I want to show you, which actually should just stayed there, if I go into the case file, there is this participant detail feature, and we have modified it to include the new intervals. So the contact interval is what the system is using to calculate the number of days for the monitoring contacts, and the number of days that the assessment's supposed to happen, and the number of days for the PCP meeting. There are a couple glitches with this, but for the most part they are working, that they're in the known issues. Right now I don't want to go into that much level, but because it's really intricate of the situations. But for the most part, you will see, so if your SC communication plan and your interventions has overridden the default, then it will show. So like 45 days is what the person wanted, versus 30 days is your default. If you didn't specify it and left it blank, it would show up as 30 days, and you'll know that that's how often they're due. So this is just a good way for you guys to easily see what the system thinks the due date interval is, because it's kind of otherwise hidden, and you have to do calculations on when the to-do's due date is versus when the last one was done, et cetera, to figure that out. So we put it in a nice little easy place for you here. Let's see. The other thing that is very nice, when you click on interventions now, it opens all of it underneath. Isn't that so gorgeous? It was driving us crazy, so we know it was really driving you guys crazy, because before these were all minimized and you had to click to expand all of them. Now they all auto open and it's so glorious. But that's one minor thing. But if you click on the informal ones, this tasks before was connected to the caregiver, and it still is kind of, sort of. If the person has a stop date, okay, then anything you change now in the caregiver or community support records for tasks won't update the informal interventions tasks. So it stays, you know, as what it was at the time it got stopped. So for instance, I stopped Jerry Garcia, so let's go pull Jerry. He's my friend. That's a good friend to have, right? So in him, I have no longer assisting in tasks because I wanted to keep him around, but he's not really active anymore for this assessment. So when I click on him in the informal, you'll see that it still has the old one that was provide support and assistance to guardians as needed. So because I stopped this, that when I changed that caregiver tasks up there, it didn't change it down here. So it preserves that now. So that was a good change that you guys caught in our last release, that we made a fix for this. The other thing that we found related to this that needed to change was related to the PCP report. So the PCP report now with the informal interventions, it works differently. Before we showed the caregiver and community supports information. Now we show that information, but only if they're in an informal intervention. Before it was showing caregivers that unfortunately, you know, passed away at some point in between the assessment and you couldn't get them off, and that was bad. In reality, that happened. That's what kind of triggered some of this. But anyway, now it will show you just the informal supports that are providing care, and then show the stop dates as well, just like all the other interventions that we have. So it's now consistent with the rest of the interventions. So that got changed. We also changed that in the same type of thing into the backup plan report, and I won't show you that because it's not that different, but this one did change because of that. The other thing I wanted to show you on here is the preferences now show in the name of the service. So it's no longer a separate column. So like this guy, when it grows, it's in a bigger column instead of breaking it up and making these much larger than they need to be. So that was a good catch by you guys too. To make it less pages was the point. The other thing I wanted to mention, I'm not going to show, but the PCP meeting is, it used to be that you could only track it for waiver participants, the PCP meetings. Now we've changed the system so that waiver participants, if you don't specify the interval in the SC communication intervention plan, and I just said those words all out of order, but in here, if you don't set it right now for waiver participants, it'll default to the 180, but it wouldn't do that for non-waiver participants. So, and it wouldn't even calculate it if you put something in it. So we've changed the system that now, regardless of program, if you put the PCP number of days in here, we're going to trigger you to have a, to do an interval set for conducting PCP meetings. So if you choose to do it for non-waiver participants, you now can. Okay. And then with the release notes, we did send out a known issues list currently that I think is all the known issues. We were updating at the last minute last night. So you can read those, and then if you find those things that are not working quite right, that are not on that list, then please contact the help desk so we can address that too in our hot fix release that we know we're going to be having. There's no date yet set for that, since we are just, most of the stuff we just found, plus we knew we were going to have to do some tweaks once we get some more data on the ADPs and CCBs. Once we get more data, then we'll be able to find more problems, possibly, that we need to resolve. So we were planning to do one anyway. Okay. Any other questions before? That was always going to show related to the release. All right. Well, if you have any questions, feel free to contact the help desk. And otherwise, I hope you have a fun time with it once we start receiving them. Because like I said, we haven't received any yet, so we are working to make sure that everything's working still, because it was working and now we weren't receiving any, which is weird. But it might be just there's nothing. We don't know that yet. We also should start receiving everybody else too, besides 10 and 2, because supposedly that's been loaded now as well, but we haven't seen them come in. So we will see when they start arriving. All right. So if anyone has questions, let us know, and otherwise, have fun. Thanks.